Welcome, everybody, to this edition of Attention Talk Video. I'm your host, Attention Coach Jeff Copper, and we're here with Dr. Kenneth Pages, a general psychiatrist. Dr. Pages, welcome to the show.
Thank you very much.
This show, one of the things that I wanted to highlight is the diagnosing process. We've done a few interviews on Attention Talk Radio about this particular topic, but we're here in Tampa, Florida, and Dr. Pages works in South Tampa area, and I have had the privilege to get to know him a little bit, and he's very thorough in his analysis. And one of the things that we always preach is make sure that you're getting the right diagnosis, because if you've got the wrong diagnosis, you're paying attention to the wrong treatment. It's also very important to find somebody who's comfortable with diagnosing ADD. And today I wanted to talk to Dr. Pages about what he does in the diagnosing process to give you an idea of a thorough process and what it kind of entails, some of the tools that are out there now that haven't been available, and to give you an idea of maybe after this interview you'll witness a little bit and be able to ask some really good questions about trying to find somebody who can make the diagnosis for you. So with that, Dr. Pages, can you let's talk about diagnosing. And now you do kids and you do adults. So let's just start with children first. Describe to me what you go through in that process.
So typically children and adolescents are brought in by their parents, and I take a standard psychiatric history from the parent, and to the extent that the child is participatory, usually adolescents have more of an opinion on how they're doing. I gather their information about home and school environment, because ADHD is a condition that should exist in both. And if they're having a problem only in one of those areas, then I try to dig deeper to see what other factors might be at play instead of a condition like ADHD.
And that's what you've described is very standard, I think, for the most part. But you also come in with Quotient's a tool that you use. You want to explain that a little bit?
So Quotient is a computerized test for children and adolescents. It takes only about 15 minutes. They stand or sit in front of a computer, and they're prompted by stars, either a three-pointed star or four-pointed star, and they have to either push the space bar when they see it or let it go. And the computer analyzes their responses and then compares that 12-year-old girl's responses to a host of collected other 12-year-old girls who have performed the Quotient test for a match for ADHD. And that is an FDA-cleared test, so it's been submitted and has been approved for that use. And it's highly accurate. You get about a 95% rate for detecting ADHD and about a 90% rate for saying there's no ADHD.
So to me, that's a real good, you do the subjective work as we've always done, because I don't think, you have to have that piece of it because it can reveal some things, because the test is not always right. And that's one of the things about ADHD. Historically, we haven't had a test to definitively say it's there. So I think this is a real interesting tool and helpful. But you go a little bit further. You also do some genetic testing. Can you explain that a little bit?
Right, and that's really, we're just at the beginning of this. It's thought of as personalized medicine. So rather than everybody gets Adderall or everybody gets Ritalin, I can test for whether the patient is going to respond preferentially to one of those, or whether I could do it the old-fashioned way and choose whichever one, because they're likely to respond normally, quote-unquote, to stimulant medications.
And we've done many shows around this topic, ADHD meds, getting the right dosage. The right med and the right dosage with the right timing is no simple matter. I mean, my understanding from other professionals is without these tests, you're really kind of flying blind. You start somewhere and you make some iterations in that process. What I like that you're describing about this tool is it kind of helps give you a little bit more of a target to start with. But it still comes back to one of the things I want to emphasize is when somebody starts medications, what I've learned is that those taking it need to be patient, because it takes a while to actually get the right ones. Is that accurate?
That's very accurate, and I think that a very common scenario, both with older children and adolescents as well as adults, is the experience they had when they were younger, and perhaps they've already been diagnosed with ADD or ADHD earlier in their lives, and say, I was given Ritalin, for example, but it made me a zombie. Or is this medicine going to take my personality away? Well, it's all around dosing. Yes. And we can make a zombie out of someone with the wrong dosage of medication. The nice thing about Quotient test also is that I can have the patient come back in a few days after being on a stimulant medication, retake the Quotient, and gauge what their improvement has been or change. Because one thing about the stimulants is that they can produce a good feeling sometimes, and the patient will mistake that good feeling for improvements in cognition, and it's important to distinguish those effects.
And one of the things we've talked about in some other interviews too is that, and I think you get from this, the genic stuff, is not only can they help you determine which med might work, but there's digestive tract issues, there's allergic, immune system issues, metabolic issues, all that stuff. As Dr. Parker said, the med's got to go through the body to get to the mind. And from what I'm understanding, these genetic tests can kind of help you dial in, particularly in the areas of liver, because it's the processing area. Can you just speak to that for a second?
So most psychiatric medicines, in fact, most medicines, generally speaking, are processed by cytochromes, which are groups of enzymes that are in the liver. And from the time we're born, whether we are normal processors of medication or slow processors or really rapid processors is determined. By getting this test, I can explain, like you were saying about patients, I may need to give a higher dose, or you may be someone that is going to have side effects to the medicine. So that's why if you go online and want to know why did Dr. Pages give me such a baby dose, it's because I'm trying to guard against side effects because you don't metabolize the medicine right.
Now, at the beginning of the interview, we talked about how you diagnose children. We have the genetic test, we have the Quotient test, but the other part is made up of interviews with the parents and teachers. How about adults? How does your analysis differ for them?
It's really very similar. I guess a couple of things that are variants of that. One is that there's not as often other sources of information because most adults come to the psychiatrist by themselves. The other aspect in adults is that because ADHD is known about, they may come with that complaint, but really what they have is anxiety or depression. Conversely, they may come with the complaint of anxiety, depression, or poor work performance, and you can tease out that since they were a kid, they've had problems in school, they are procrastinators, those kind of key features.
Now, this is an area that's very fascinating because one of the things that's really in the news these days is medical diversion or medication diversion. There's a lot of talk about in colleges and stuff, people are getting the drugs and giving it to people that don't have ADD to study for tests, and it's become a real issue. And it seems to me, just professionally, that having some of these more quantifiable tests is actually a layer of protection for you as an individual because in the old days, when it was purely subjective, literally somebody can come in, if they were a good actor, maybe put one over on you, if you will, through no fault of your own, and it contributes to the problem. Can you speak to that space? Because I think it's becoming a big issue, and I think that things like this are not only good for the patients, but they're actually good for the treating mental health professionals.
Well, that's very true. You don't even have to be a good actor. All you have to do is state a bunch of symptoms. And while that's true of all, unfortunately, in psychiatry, most of what we depend on is a patient report. The difference with ADHD is that the treatment are desirable medications. Stimulants help people without ADHD to think clearer. The problem is that people with ADHD, they tend to get on the right dose of medicine, and very often that will be their dose forever. If someone without ADHD takes a stimulant, they will become accustomed to those effects, and usually their dose will escalate.
Really? I didn't know. So what I'm hearing is that they become accustomed to it, and so their need escalates. Whereas someone with ADD, if it's treating the ADD, it's once the dose is dialed in, particularly in adulthood. I would expect it changes a little bit for children sometimes.
Right, because they grow.
Yeah, but for the most part, that's fascinating.
Yeah. And the other thing, too, is that you had mentioned in an earlier conversation about how in a poll, it was shown that doctors are not that comfortable with diagnosing ADHD. I bet if you tease that apart, they're not comfortable with the medicines that are used to treat ADHD, and that leads to the discomfort. That
makes sense. And it's interesting to me, just some stories that I've heard of where they've uncovered medical diversion is people going to somebody's selling their house and moving, and somebody comes in looking for a house, and basically they go rooting through the medicine cabinet to find meds. Or in colleges, they find out who has ADD, and while they're not looking, kind of go through that stuff to do it. And it is a real problem. I don't want to minimize it, but at the same time, meds can help those that are in need. And I think that for you out there, if you're looking for a good mental health professional who's doing a thorough diagnosis, that what Dr. Pages has described are good things to look for, good things to ask for. And then if you are a mental health provider, having some of these tools in place in the file and on record will show at least you're going through the due diligence to ferret it out as much as you can. So one other thing I want to touch on just very, very briefly, and that is, and I think we talked about this, when you're diagnosing an adult, sometimes if the if it looks like they have ADD or ADHD, you're actually screening for substance abuse. Can you speak to that for a second?
We're always screening for substance abuse in all of our patients, and again, we're often relying on their self-report of this. We have started to monitor urine drug testing results in our patients here in the office. Part of that comes out of the diversion issue that started with opiates, which are also class 2 medications. All the legitimate pain doctors are using drug testing to make sure that the patients are taking the medicine, and that's what we've started doing with stimulants as well.
It's awesome. It's a key point. We've done a separate interview with Dr. David Teplin on ADHD and substance abuse. If you're interested in that, go check that out on Attention Talk Radio. I think you'll find it fascinating. So, Dr. Pages, is there anything else that we haven't covered?
I don't think so. I mean, I think it's what is gratifying for me about treating ADHD is that unlike other conditions in psychiatry, the response rate to treatment is very, very high. So, as you were saying, as we've been talking about, to have a diagnosis, have some objective measures on the chart, and then see objective improvement with treatment, really it makes my job very nice.
And you can really impact lives. Yeah. So with that, everybody, this is Dr. Kenneth Pages in South Tampa, Florida. Really all you have to do is Google Kenneth Pages in Tampa, and he's going to show up. And if you've got any questions, call his office, or if you need a diagnosis, I encourage you to come in. He cannot treat you across state lines, so you have to be here. But again, one of the keys is find the right person who can do the right diagnosis. So with that, Dr. Pages, thanks for coming on the show.
All right, thanks, Jeff. Okay.
Take care, everybody.